Welcome back to another episode of the Autonomic Dudes, just two dudes instead of three. I'm Dr. Rob
Yes.
Wilson, and my great colleague, Nick Zapata, is here, our summer intern, who I think we need to give you a new title for all you've done. But Kyle Shannon, nurse practitioner, APRN, is away on vacation still. So just you and I, Nick, right?
Yep. Talking about mental health today, how mental health is integrated with POTS.
Yes, you cannot talk about any health condition without mental health. It is the elephant in the room. It should not be viewed as the elephant in the room. It is the essential part of the care package.
I wouldn't, I'd say it's like the hidden elephant in the room because it's not the most obvious thing at first, but it definitely impacts the patients and how, at least from what I've seen, how they enter the room and how they leave the room.
I mean, you're right. I mean, you're a lot younger. You are, how old are you again?
19.
19. I'm going to say your age is important because I think Gen Z, ever since 2020, when the world changed for so many reasons culturally and with COVID, has embraced and acknowledged mental health. We probably still struggle for adequate services, but there's this honesty and greater transparency about mental health. It is what it is. People have it, as opposed to someone like I, who's in his 50s, where the culture of medicine and the culture of society generations ago, it was still much more delicate how we embraced it, talked about it, and shielded it. So I think your generation is really, with many things in the last few years, has shepherded us into a better way of approaching it.
Mm-hmm. That definitely like I've through my experiences in life, I'd say I'd see mental health like I would define it as like the perspective that one goes through life, like the lens that you see your reality through. Because everybody has a unique reality. Everybody lives in the same world, but everybody has a unique lens that they look at that world through. You can look at it with hope, with despair, and or it's just like it's your own experiences that make up your mental health and therefore make up like how you see life. Like that's how I would define mental health. It's very unique.
It is, you're right. And it's not as easy building your theme, what you're commenting on is haves and have nots. People can
Yeah.
have everything that seems okay, lots of money and economic means and access to healthcare, and still have depression and anxiety. So it's not as easy as the haves and have nots. Or we know that when people have more challenging social determinants, like access to healthcare, access to driving, access to food, access to housing, that can render them more vulnerable to mental health, or the impact of being sick can render people that level. And then there's something we're still learning about susceptibility, that some people are probably more vulnerable, just like diabetes and other medical conditions that can make people tick over, trigger to depression and anxiety. So I know you've been really wanting to do this episode forever from day one.
Yeah.
So I'm gonna let you lead this a lot.
Yeah. Um, Thank you. I appreciate that. Well, right before, like while I was coming up with the outline for this essay, I mean not for this essay, for this video, for this podcast, it got me thinking like in comparison to last week's episode about the gut and the GI, it's very different because I was like, it's not as easy to take notes on mental health. I can't just say, okay, these are the symptoms of mental health. These is how you fix mental health. It's not that easy at all. So what I wanted to focus on mainly today was like anxiety and depression and like the research that has gone into that stuff in correlation with POTS. And POTS as a chronic mental and POTS as
Physical,
a chronic illness can feel very hard to escape. And I think
yes.
that's what brings on a lot of these mental health issues.
Well, I think you're right. Is that many health conditions that plague people in our society, neurologic conditions, and then mental health, there's not an easy one fix. Your brain is an electric neurologic highway. Just as your car goes down one road and it starts going down these paths and patterns of going, or like your cell phone will start going down paths and patterns of doing things, or other social media paths and patterns. Once your brain starts going down paths and patterns, it can be hard to flip it back. So often
Yes.
people get to that point of depression or anxiety,
Yeah.
where everything seems bad and there's no tomorrow, it might have been that tipping point of that darkness, that invisible cage. And it's not so invisible if you live it, right?
No,
And
I 100% agree. It's these patterns that you get down into, and you sometimes you even realize that you keep on thinking the same things over and over and over again, and they don't even make sense. And you know that they don't make sense, but you still think them, and it
and
sucks. That's in that
yes.
moment, that's all you can think is that this sucks.
And I think what happens is it shows that like often people get to that point, things have maybe been brewing for a while, and then things tip them over, and that susceptibility of those neurologic pathways of the brain are sort of kicking them over. And you'll see people who have these conditions where it could be an illness. They already have like the POTS, an autonomic disorder, and then they get COVID on top of it, and it just tips them over, or their body gets beaten
Yeah.
down by another thing, or seasonal affective disorder, the light changes, the circadian rhythm, the daylight shift of their schedule changes them. Or I've seen people when they lose, their pet, or a medicine disagrees with them, just shift their chemistry just enough that something's just happening and just flips them over in that level. And it's much more complicated than just saying like, get happy, be happy, have a good attitude. It's never going to be like a pillow that says be
Yeah.
cheery, be happy. I wish it was that easy, that self-talk. And you're right, and those thoughts enter people's head. And it's a very powerful wave to fight against. And there's reasons why that we know most neurologic conditions are associated with more anxiety, depression, and mental health disorders than the general population who do not have neurologic disorders.
Mhm. No, yeah, I agree with that. And it's just like POTS and other like chronic illnesses like that. They kind of like uproot people's lives, and people that before were used to be like really active and healthy and running around, you can't really do that anymore. And like while I was reading, that's another reason that like it can cause depression and all that, because it just takes away all their habits. You can't do what you used to do. Even if you weren't like that before, you can't do what you wanted to do.
Yeah, there's that aspect of that there's a few things with POTS I think make people vulnerable. The sympathetic adrenaline, I think we talked about in our podcast, that
Yeah.
creates an anxiety feeling, that pending doom, which mimics and feels like anxiety. And people will say this is different than anxiety. And we've had research that really shows how to differentiate and the challenges of medical care of differentiating anxiety from adrenaline and what it can be for people. But you're right, there is this whole grief response. The person I was, the person I had been, my life is different. My demands in my life, I can't do what I used to do for work or school, my daily life. I mean, people wake up in the morning and like, I need to make my bed, or I need to get a meal prep. I need to do this. I need to do that. And it's a struggle and it just weighs you down. And I think when I say the word way down, it's an experience of someone's being. And sometimes with depression, anxiety, there's really no words to describe it until you experience it yourself.
Yeah, that I 100% agree with. It's really hard to describe what anxiety or depression feels like to another person. It it's like you're drowning, but that's not even the right way to say it. Like it's hard unless you have experienced it.
Yes.
And yeah, no, it's I wanted to add on to that sympathetic adrenaline. The way I've understood it, since you've taught me that symptom and that reason that anxiety is caused that way, I've always kind of understood it as your brain knows that something is wrong. It knows that like your nerves can't really detect it, so it just sends out a ton of adrenaline. Like, okay, let's jumpstart these nerves. That's the way I've understood it. It's like jump starting a car, but it's just sending way too much adrenaline, way too much, and the byproduct is the anxiety that you experience.
It does do that. It creates this jitteriness or this, excuse me, this hypervigilance, we call it, this sympathetic overdrive, this impending doom, that sense of something's not right. And it can be tricky because we know 20% of our people have, in our general population, even without POTS, have anxiety disorders. So it's a common part of the human condition So if you look at this, maybe 1 out of 5 people with POTS may have anxiety just because they're just humans. And then you get this thing that sort of triggers and defaults the brain. The brain goes down that pathway of impending doom, hypervigilance, expect the worst, that creates an anxiety feeling. It's not going to make you feel like everything's a vacation. This is the best day ever. This is not going to be that beautiful holiday experience. This is life is great. And so it's a wave against it. And then you add it on when you're sick chronically and you don't know where time's going to bring you, that uncertainty and that weighing down on what we can't do anymore, people really feel compounded. And then if each day you have this blanket on you of not feeling well, that can layer in depression. There's a lot of self-talk. And that's where things like resilience gets into this. We often explore people, what's your resilience? What are your core values that get you through it? Like people say it's my kids or it's my pet or my faith, or what is that resilience in you that pulls you through it? That's often the key.
No, yeah, and it's kind of like a feedback loop. Like you say these things about your like one day you're not able to make your bed, and then just because you're tired and you're say, I don't want to make my bed. I'm tired, and that's okay. But throughout the course of the day, you start saying these things to yourself, and that just makes you feel even worse. And then the next morning you're like, I don't want to make my bread. I just feel so bad, and then you feel even worse and worse. It's very hard hole to get out of. It's a hole that's being dug and it's very hard to get out of. And
And I like the metaphors that you're using, Nick. And I see a different part of you today that's very caring. You're always caring. And that's saying you're never not. But I think there's a part of you that's a deeper dive and sensitive. And there's the honesty, right? We're talking about honesty because it's not discussed as much. And we've done some research and we discussed this that sometimes that maybe we trust the adrenaline more and not enough of these what the anxiety's doing or the upheaval of life has done to people. But I think is that we've lived through a culture and we still do many cultures where that mental health is not discussed. We often still have, you look at some of the ads, even from the government, how they're trying to give people tools to talk about mental health and depression to their support people and their family to make it embraceable, approachable. And I think what you're doing is you're trying to have this honesty. You're almost trying to get through the Zoom virtual wires and say, hey, we get it. Depression is not sadness. Anxiety is not just worry. It's something in people's lives. It's bringing you to a place that sort of really is a sickness. It's taking your life in a way that you're succumbing more.
hmm
It's consuming your thoughts. It's consuming how you go through your day
hmm
and things that can be done with it, either counseling, social work, medications, a wellness package, and treat your underlying condition. But there's an honesty that you're bringing forward saying that we need to talk about it. And there's nothing to be afraid about this. This is not about you did something wrong or you failed. You failed.
I think the biggest thing that makes this like an actual illness and disease, like anxiety and depression, is that from an outside perspective, it seems like something you should be able to control and get under.
Myth.
But when you're actually experiencing it, it's the complete opposite. You can't control it. And I think that's why it's an illness. It's beyond your control.
Yes.
Okay. That's a bad way to word it because that makes it sound like you can't do it. I'm realizing this as I'm saying it's a bad way to say it because that makes it sound like you don't really have any control over it. I think, and this is, I might be getting ahead of myself, but I think for
Take your
me
time.
personally, the best thing to do is to try to understand yourself. That's what's worked for me personally, is to try to understand myself. And like I was saying earlier, those patterns of thoughts that that one has in those situations, you gotta. I think one of the most important steps is to recognize when you're having those patterns. And once you recognize when you're having those patterns, maybe you'll be able to take a moment, take a breath, and take a step back and be like, does this thought make sense? Is it rational for me to say that I'm a bad person for not making my bed this morning? No, that's an irrational thought. That's
Yeah,
one of
mercy for yourself. You're right. You're right. Excuse me. Some mercy for yourself. And I think, as I said earlier, when people get to that vulnerable tipping point of this rawness that things been going for a while and the brain gets stuck in that chemistry. And when you say that nothing they can do or it's chemistry, they might need help. So
Yeah.
that's where like sometimes we all have a bad day, right?
Hmm.
Sometimes people culturally Mondays are hard for people. When people don't feel well, they feel very blah for when they're cold and they'll snap out of it. That's normal, right? We all feel that way. And it can snap out of it. But you're talking about something that's different where you might need more help. This is not as easy as snap out of it. So I think what you're saying earlier is that this is much more of a concentrated effort of a
Yeah.
team approach, and having that sort of wraparound care and getting the services that you deserve. I mean, the brain is a powerful thing. You're born into this world within days, you're already learning language, responding, cueing. A baby's already looking into people's eyes, looking at people, learning things, and anchors to things. So these pathways of being and thinking experience get locked, and they can be locked into a very rooted way of this, and it could be neurologic pathways of depression and anxiety. And we're talking about depression and anxiety because they're the big two. And I always say depression and anxiety often are like a quarter, though the heads and tails are opposite, but they both belong to a quarter. And often depression and anxiety belong to the same thing. People with depression and anxiety can have the same thing. People with depression have a lot of anxiety, a lot of people with anxiety have a lot of depression. They can blur together. So it is, and I think is the willingness to say, like, I'm going through this. This what's going on here. This is sort of I need extra help. I've tried these simple maneuvers and it's not working. I think you're hitting on something very important. We're in a culture where there's so many ways of the last few years of wellness line tips and tools. And if you've exhausted this and it's not working, then you need some extra help. And that's what I think you're talking about also.
Yeah. It's sorry, I'm just gathering my thoughts.
No, yeah, you're good. Take your time, but I think it's like there's so much wellness things like journaling and breathing
Yes.
and these apps out there. I'm not going to mention their names, but
Yeah.
if they're not working, you might need a little extra guided care, and that's okay.
I
Psychology,
think I think journaling is a really good method, and this is kind of jumping forward. I've in my outline I have like 8 questions that or 7 questions, but like I have a question that was like, what are some ways that like the patient can do to get into a not just into a better mood? And one of the things that I should have written down is journaling because journaling allows you to slow down your thoughts, put them on
yes,
paper, get them out of your head, and just get them out of your head. Just put them onto paper, let you think more slowly. But
yeah.
also, like we talked about this in episode 5, I think it was like in what you can do at home, just like doing those workouts and doing isometric exercises. It's been proven to like get out like endorphins and those have a feel good chemicals proven. And there's this method, the 369 method, where it's like you say,
Oh, I love that one.
yeah, you're the one to tell me about it. And I had to search.
Oh, there you go.
It's where you say like three affirmations in the morning, like today will
Yes,
be a good day. Today will be a good day. Today will be a
yes.
Then in the afternoon, you say it 6 times. And then at night, right before you go to bed, you say it 9 times. And do that for like 33 days, and apparently it works. But
It's,
um,
it's
and
the
just like
gratitude.
affirmations in general, because I kind of touched on this earlier in another episode, but I'm a big believer of putting out good energy because even if it's not like you're actually putting out good energy, like spectral, whatever, I think it creates pathways in your brain because when you it's like when you're thinking all these depressive thoughts like, oh, I'm a terrible person, you're creating those pathways in your brain. And even when you're not thinking that, those pathways are still being touched, those pathways are still being used, and they're still affecting you. So if you try and make the effort of saying, I did good today, even if you don't believe it, you are still creating those pathways because you are saying it, you are speaking it, you're creating good pathways in your brain because good has good connotations. It has that meaning.
You're basically taking your thoughts as if there's a roadblock in the
Yeah.
highway of your brain and go to a new road of travel. And for people who are depressed and anxious going to mental health, the natural feeling when they hear this is like, oh, here they go again, that level. It's like journaling. If you're depressed and you feel very blah and very fatigued, journaling is the last thing you want to do. It doesn't feel natural. It's like breathing exercises are very not natural. They're very uncomfortable for people with autonomic disorders. Initially, they have to lay down, they can't breathe. A lot of these things are just not a good experience. So I
Eh,
think it's small steps and try it. And a lot of times it's a sort of effort to find ways between medication or work with therapy or these insights. And sometimes you'll find sometimes by these endeavors, what is that thing that's always been sort of going on with this? One person who did journal, and this person did do it, it was against it for a while, and did journal, realized for this person that shame, shame, was a core issue. Tremendous shame that preceded getting sick, and then once getting sick was just feast,
Best.
festering,
Yeah.
festering. And so there's a lot of things that are going on. The brain takes care of the body takes care of the brain. They flow together. Descartes was a famous
Yes.
philosopher who said they were separate. He was wrong.
Is that, yeah, no, I agree. It was like the mind body dualism or something he was saying.
Yes, very
And
good. 2 points.
and yeah, it's you can't have one without the other. If you just have a brain without any of the blood, without any of the hormones, without any of your body, it's it's just a blob of jello. It doesn't do anything. And if you have just a body without a brain to tell it what to do, then you also just have a blob of skin and bone. You have to have both. And if one is healthy and the other is not healthy, that's an unhealthy you. And I don't want to say that in like a derogatory way at all. You just have to make sure that you are a healthy you. You have to make sure you are at least trying to be 100% or trying to be, I don't know how to word that without sounding like crazy.
I think what you're trying to do, and you realize because you've seen these patients, you see the physical suffering, and you see
Mm,
the toll it takes on them, their life experiences, and you have seen some of these patients. Many people, 20%, 30% of people in our society go through depression and anxiety. So
mhm.
you've seen the patients with me, and you've seen what people go through.
Yeah, and
So,
that's
um,
why I'm having, sorry to interrupt you. Um, that's why I'm kind of having a hard time like finding words right now because I've seen what you guys go through, and I know that it's hard, and I know it's not just like, oh, I'll do this when I don't want to do it. Or I'll think happy thoughts when I can't. I have no perspective. I only have an outside perspective, and I'm trying very hard because for me to see like you guys leave the room with hope, it's a very good feel because like I see you guys, um, or just patients in general come in and they're asking for help and they're sad and they don't know what to do and they're scared because it's a chronic illness. You don't want this. Nobody wants that. And it's the best to see people leave the room with hope because that's another thing I wanted to touch on. Like, hope is very, 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 very important because it's kind of circling back to what I was saying about creating those pathways. If you don't have hope, you're just going along the same old pathways, and that kind of affects your whole body, in my opinion. And I don't
and
know too much. I'm not a, you know,
I think it's good, Nick, what you're saying. I think is that these patients you see people with mental health issues or health sickness, what it does to them. And I think there's this very difficult trap that people get with their health. And this is not judgment of them at all, but the fatigue, the reduced stamina, the experience in their mind, their cognition, and their emotions happens when you feel that blah. So people who don't have this disorder, it's like having the flu. You just feel you have no energy to do anything. So you have that experience like, ugh, how am I going to do anything? And then people are telling you do this and do that, and you just like it just compounds it. And then depression and anxiety get into it, it just puts people in this darker pit, this dark gray pit.
yeah,
And you've seen these patients with us. And I think is, you know, you want people to have genuine hope. I mean, I've been sort of nailed for using the word hope. Hope can be a four-letter word. So you want to have genuine hope. Like hope
yeah.
can be, can we have you leave your house today? And hope be that you'll come to this appointment. Can hope be that you'll refill your medications?
Just those
And
little goals.
small steps.
Mm,
Hope we have you see a therapist. and it's so overwhelming for these people um, that it needs to be that level. And when people feel this bad, like these words that were often very toxic positivity or culturally overused can be very challenging for them and alienating. So I love this conversation we're having because I think it's like we want people to understand if they're going through this, get help. It's part of the package being chronically sick. People are chronically sick or high risk of depression, anxiety for a lot of reasons. When the body's sad, the brain gets sad. When the
Mhm.
brain gets sad, the body gets sad. It's
Yes.
very good science. And that there's a reason why people may not be able to engage in all the tips. We can say to people like, you do this, you do that, you do this, you do this, you'll feel better. It might not be as easy as all that. And for people to succeed, and it has to be small steps and what you can do. And then people may really need a wraparound. That's why a lot of times these patient programs are very good because the patient times will actually say, hey, you know, I did this and you can do this. And how about you just did this? And they laugh it out and they do that support. And then some people really do need ongoing counseling and sometimes you need for psychiatry. Psychiatry is not a place where bad people go. It's a place where to work with the chemistry of the nervous system in that realm.
Yes, and it's a very complex thing, and I think you're talking a lot about the help that we need to give them and that they need to seek out. I think that the best thing a healthcare provider could do is not even just prescribe all these medicines, is just to hear and understand and listen to the patient and make
Yes.
them feel heard. Like that's the best from what I've seen and experienced. Whenever a patient is heard and understood, they leave the room thanking the 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 healthcare provider for listening to them and believing them, believing their experience. Because like I was saying earlier, everybody has their own reality. And to some people, someone else's reality may seem unbelievable because it's nothing like what you've experienced. But we
Well,
just
you're right. You're right. I mean, there's this article that I read about culture in the last 4 years, in 2020. People really want validation more than ever,
Mhm.
and they want authenticity, people to be genuine.
Yeah,
So it's a big deal. I know we're coming down to the end of all this, but
that's
you
10
know,
minutes now.
you know, I'm older. I always have you be your father. I think it's great that we have this young blood. I'm not saying old blood. I'm not going to do this. There's nothing old in ageism. There's nothing but ageism or old. But I'm just maybe doing this longer because I feel equally sad for people. People go through mental health disorders, and I believe it. I feel for them. It's horrible. It's sad. It's a major disease, and that's why we're doing this podcast. And I really like your reflections and your comments and your inputs. What you're bringing. It's you care. And I think a lot of other people in their families may care, but they may not know what to do.
Yeah,
They're- yeah, and I think a lot of times, even with the internet, people can always Google, like my spouse is depressed, my loved one's depressed. How do I talk to them about depression? There's things the internet will automatically now give you smart words to say instead of just saying like, be happy, right?
yeah, people want to help, and I think that's a very important thing because I think there is this stigma against it. I think before everybody thought, oh, everybody's too busy to listen to me complain about my complain. I say that with quotations because it's not complaining; it's just speaking on what you're experiencing. I think there used to be a stigma, and I think in recent years that stigma has been lifted. And I think that's a very important thing because when you talk about your issues, you're not even though it may feel like it, you're not burdening other people. You're not burdening your healthcare provider because it's a very important part of who you are and how healthy you are. I think
Yes.
it's important to make that distinction.
I love what you just said because I think sometimes I sit with patients and they'll talk about their mental health and what they've been through in all aspects. And I say, you're probably one of the bravest persons I've met. And the honesty and the transparency is respectful and a beacon of guidance.
Yeah.
You need that. And I think Nick, you give hope that, we have this next generation, that sort of is willing to be this way. And that's why you're doing this.
Yeah.
Um, We have a few minutes left. I'm going to let you, we have like 5 or 6 minutes left
Yeah.
for mental health. If you give some quick tip to somebody, um, you know, to somebody, what would you tell them in this podcast?
Um, I would tell them to sometimes you got to do the things that you don't want to do because in my experience, like the things that you don't want to do, when you finally do them, those are the things that give you the best rush of just happiness. Like, yes, I did this. I did it. I did it. I did it. Even if I didn't want to do it, I did it. Like most of the days I go to work out, I don't want to work out. I don't want to do it. I want to stay at home and watch TV. But then I do it and I feel great afterwards because I'm like, I didn't want to do it. I went outside, I did it, and I feel great now because I overcame my inhibitions. I told myself no. And again, incomparable, really, but it's an analogy. If it's to those type of situations, you got to do what you don't want to do sometimes. And I learned that from wrestling because I never wanted to go to practice. Every single day I hated going to practice, but at the end of practice, I I just felt happy because I enjoyed it a lot. I loved wrestling, but
That's great. I'm going to build on your theme. If you're going through something that's like a mental health, depression, anxiety, post-traumatic stress, and more, um, you think so, ask for help. Don't feel embarrassed.
Mhm.
Don't feel ashamed. Don't feel guilty. Don't let someone make you feel that way. You're the honest, brave, strong, confident one that wants to do it. And building a next theme is when you start doing things, it's going to feel like you don't want to, and that does not feel right, and it feels wrong. They say in therapy, when you don't want to go, is actually the most likely time you need to go.
Yeah,
And
that's what I was
so,
getting at.
yeah, so it's a very telling point when people feel that way. So, part of the tricks of the brain sometimes, the illusion, the things sometimes you need to do, your brain's often telling you no.
Mhm.
That's kind of challenges. All right, I think we're coming to the end. We miss you, Kyle.
Yeah, Kyle, we miss you, man. You got to come back.
He's gonna
Beach.
be a lobster. He's gonna be a red lobster.
Oh my
All
God, he's at the
Sunday.
beach I'm at right now. I think I just saw him.
All right. Well, take care of yourself. We hope please share this with with your medical providers. They could be your physicians, APRNs, PAs, nurses, psychologists, your family. Hopefully they'll listen, and your other POTS and autonomic friends. Nick, you are awesome sauce.
Thank you.
Um, your honesty, giving heart, and thinking smart brain are appreciated always. So bye bye, everybody.
Thank you. I hope you guys have a great night. Remember to understand yourself and to try because it's a long journey, but you got to try. All right.
Yep.
Thank you. Thank you for
Bye bye.
listening. Please subscribe, follow, and share if you'd like, and leave a comment. All right. Have a good one.